Thank you very much. First of all, can you hear me at the back? Okay, good. Thank you for those very, very kind words. There's several ways I want to respond. First of all, slightly humorously, I'm glad you said all that, because now my wife knows what I do. But much more importantly, this award is very, very special to me, and I will come to that at the end. It's really a privilege to be here. It's a great honour to receive this award, and I hope that in the words that I say, I will do honour to Dr. V. I'm not going to show a PowerPoint. I'm just going to talk. And what I want to do is to share with you some of my observations about Dr. V, but also about Aravind. And I want to share those observations as an outsider, trying to be objective, but I also want to make it very, I hope, relevant and practical to each of our lives, and also to myself. So I want to start with a little bit more about Dr. V. And these are things that I've read. And I'm going to touch on certain aspects that maybe sometimes are not so frequently talked about. As was said, he was born in 1918. He was the eldest child of a large family, reasonably well-to-do, and he had the opportunity to get educated, and he worked very hard and managed to get a degree in chemistry before going on to study medicine. At that time, as a young man, he became seriously ill. He developed arthritis, and I understand that he actually spent 2 years in hospital hospital being treated. And before that happened, his desire was to work in obstetrics because he'd been moved by the fact that some women he knew, neighbours, had died in childbirth. And this was of deep concern to him. But because of his illness, he couldn't do obstetrics, and instead he turned to ophthalmology and studied ophthalmology, and at the age, I think, of 36, he qualified as an ophthalmologist. And if you like, that is the first part of his life. 36 years, which I will summarize as learning. Education, but also learning about life. And I would really point out to you probably that the biggest learning during that time was to suffer, was to have the illness, to be hospitalized, to be a doctor under medical care, to know what it's like to lose control of your own life and to have other people controlling it. So having trained as an ophthalmologist, he then began to practice. He worked in the government service, and for the next 22 years, he practiced ophthalmology, and despite his arthritis, taught himself cataract surgery, performed more than 100,000 cataracts, but more importantly, made that care available to poor communities, starting the ideas of eye camps and outreach and going, not satisfied just to sit at home. And he retired from government service age 58, which was the requirement, having done a great deal. 22 years of work, 100,000 operations, trained many ophthalmologists to follow in his footsteps. And that phase of his life was doing it. The first phase was to learn, and the second was to do it. And I guess age 58, most of us would now think about stepping back and retiring, and we've done our bit, but not Dr. V. He persuaded his brothers and sisters to give up their money, give up their time, and to start a small 11-bed eye clinic known as Aravind. I think that was 1981, 1976, at the age of 58. And the next 31 years, it's now 39 years, but for him 31 years, we see what happened from an 11-bed idea and a few brothers and sisters and a little bit of money to what we have today. And actually that's not the bit I want to talk about. What I want to ask is, how on earth did it happen? How on earth did that happen? I met Dr. V a few times, never for very long, but in some conversations and some personal one-to-one conversations and in some workshops. And I'm going to be kind of quite blunt now. He wasn't impressive. He was a small man, quite thin. He wasn't a big guy who stood there and told you what to do. His voice was very quiet, and if you weren't used to his accent, me as a foreigner, I was always, what did he say? And trying to understand what he said. So he wasn't an impressive speaker. He couldn't stand up and, or didn't stand up and hold audiences of 1,000 people. He wasn't big, he wasn't a great speaker, and he wasn't rich. So how did it happen? And now I want to switch, and I want to talk about leadership, having set the scene with Dr. V. he at one time said of himself, I have an inferiority complex. And yet he became a great leader. So what was it that made him a leader? And what can we learn from that? Next thing I want to talk about is, if I say to you leadership and a great leader, who do you think of? Who comes into your mind? Maybe Gandhi, Nelson Mandela, Hitler, Hitler was a leader, and in terms of people following him, he was a great leader. Not all leadership is good. That's the first misconception. In our thinking, as soon as we think of leadership, it has a positive connotation. But actually, leadership can be used for negative outcomes. That's the first thing I want us to remember, and we'll come back to it. The second thing, if I say to you, who have you followed in your life? Who has made an impact in your life? Who comes to mind? It's probably not Gandhi or Nelson Mandela, but it might be one of your parents or a grandparent or a teacher who particularly inspired you, and you decided you wanted to follow what they said and what their example was. So leadership misconceptions, it's not always used for good, and secondly, it's not about a few special people. It's about all of us. All of us are leaders in our own ways. And the question is whether we can harness our leadership skills and whether we will then use it for good or not. leadership, I think there are three things. And each of the three have got a couple of points to them. So please bear with me, and we'll come back to it at the end as a kind of reminder. The first point in leadership is values. What are your values? What do you put forward as being important in your life? Have you ever thought about it? Do you identify your values and actually then try and live them? If you say my value is to respect everybody, do you respect everybody? If my value is integrity, actually, are you always honest? And can you be trusted? If my value is justice, well, do you practice it? So what are our values? Because our values will determine whether our leadership is for good or not. If our values are not good, then the leadership can be used in the wrong way. The second point after values is what is our vision? That word is used a great deal, but I want to use it quite simply. What do you want to achieve before you die? I went on a course about 30 years ago. It was only one day. It cost me quite a lot of money, £200. There was 15 or 20 people on the course. I didn't know any of them. And we came in the morning, we all sat down, there was a pen and paper, and we were waiting for this man to teach us. We were all there for this special course. And he said, write down 5 things you want to achieve before you die. And then he went out. And I was angry. And I don't normally get angry. And I was angry, and I was thinking, why am I angry? And I was thinking, I'm angry because I paid £200 and he's just come in and gone out again. And then I thought, no, that's not right, he'll come back. And then I thought, I'm angry because when he comes back, maybe he'll pick on me and say, what did you write down? And in front of all these people, I'm frightened. And then I thought, why am I frightened? I don't know them, and tomorrow I'll never see them again. And then I realised I'm angry because I'm 40 years old and I think I'm intelligent, and I've never asked myself that question. That's why I'm angry. What's your vision? What do you want to achieve in life? And it may be very simple things. When I began to think about that for myself, the first 3 or 4 things in the 5 or 3 were all about my family, nothing to do with work. I want to be a good husband, I want to be a good father. Well, how are you going to go about that? If that's what you want to achieve. When you're put in the grave and people are standing around, who do you want to say he was good? It's your family, your close friends. It doesn't matter what the rest of the world says. So what do you want to achieve before you die? What's your vision? The combination of those 2 things, values and vision, gives you the word passion. It's what you're passionate about. It's your driving force. And for leadership, you have to have passion based upon good values and clear achievements that you've set, things you want to do. Having got that, which is very nice, I've got passion, I've got values, I've got vision, and now I'll go and tell the world about it. I promise you they won't listen. Because what the world wants to see is a demonstration of that. Dr. V spent 22 years doing it. 100,000 cataracts. He had to show how it was done. He had to lead the way. He had to enable others to do it. And when he did it, then others began to say, well, if he can do it, maybe I can do it as well. But very often in vision and in showing the way, you'll get obstacles. People will say, you can't do it that way. We've always done it this way. That won't work. so part of leadership is to challenge the status quo, to see the vision, but to say we can change, we can make the world better. This is how it's done, showing the way, and also challenging the status quo. And the combination of those two things takes years. It doesn't happen quickly. And therefore the second word in leadership after your passion is perseverance. You have to do it. And you have to fight all the battles. And you have to keep doing it and keep doing it. Persevere in doing it. Lots of people can have passion about things, but they don't do anything. Passion and perseverance is strong. But that alone is not enough. Because you can be passionate and you can persevere, and at the end of everything you can look behind and nobody's following you. And leadership is about fellowship. Are the people behind who are following in your footsteps, seeing your passion, seeing your perseverance and your example, and actually saying, I want to be part of that. I want to do it as well. And for that fellowship, you then need to enable them. That may be skills, training, a quiet word, and you need to encourage them. When things go wrong, help them over it. When things are going well, celebrate success. The word of encouragement together with enablement will bring this fellowship along. Dr. V, in the latter part of his life, went about doing that. He invested his time, and this is the last bit of leadership, in people. He got the passion. He demonstrated perseverance, and then he invested in people. They are the three essentials for leadership. Passion from values and vision. Perseverance, doing it, showing how it's done. Challenging the status quo. And then people, enabling them to do it with how it happened. That's his life. That's how our lives can be. And it may not be big things. It may be in our family, but it's the same. Are you passionate about your children? Are you bringing values? Are you giving them vision? Are you modeling the way? Do they see in your behaviour the way they should be? People spoke about everything that I did to boo me and IAPB and CBM and so I can promise you that in doing all that, I did nothing in the family. The leadership in our family is sat there. The reason our children are not mentally in ill health is there, not here. The reason we have good grandchildren is there. Leadership applies to all parts of life, and no one bit is better than the other. It's what is your role in it. But the principles are the same. Passion, perseverance. We have a grandchild. I digress. We have 3 grandchildren. Somebody told me that they always like my grandchildren's stories. So I tell you, we have 3 grandchildren, 13 and 11. But now I tell you about the 6-year-old. The 6-year-old is called Toby. 6. Toby has a willpower all of his own. He knows what he wants, and unfortunately, he can always persuade his mother that what he wants, he'll get. Consequently, when he leaves his mother and comes to his grandfather, there is a battle of the wills. Toby wants this and usually gets it. Grandfather decides, I will show discipline. Grandmother is the one who shows perseverance between these 2 willpowers, right? And quietly comes between and helps us continue to be friends. I have to tell you a story about Toby. This is totally different, but you'll like it, right? We come from a Christian faith. So at Easter, we go to church to remember Easter. And my son had gone to church with Toby. And my son doesn't normally go to church. He went especially because it's Easter. And then driving home, Toby says to his father, "What happens when we die?" 6 years old. So his father says, "We go to heaven." So Toby thinks for a few minutes, and then Toby says, "Where's heaven?" And his father says, "I don't know." And then Toby thinks for a minute and then says, "Never mind, we'll Google it when we get home." So I want to finish the talk now with the kind of, we've talked about the life of Dr. V and those 3 bits of learning and then doing it and then the sharing it with other people. And we've taken that as the essentials of leadership, the passion from vision and values, then the perseverance of modelling how to do it, showing the way, and overcoming the challenges. And then lastly, the investment in people, enabling them, encouraging them to do it. But there's one special thing to it. That is leading others. Everything I've said is about leading others. You cannot lead others safely until you lead yourself. If you can't lead yourself, where are you taking others? If you don't know what it's about, where are they going? So it's very important that you have a clear understanding of yourself, your own place, and what you are about. And then the last bit to that is, are we able to look to and to be led by the Almighty? If the leading is ourselves, then actually it's still all about us. If we are being led by the Almighty, then we're part of a much bigger thing, which is the part of the whole of creation. And that's what Dr. V had. It wasn't about him. It was that he was answering God's, the Almighty's call in his life. He had words, he says, not what I want, but make me do what you want. I don't have the exact wording of it. But the thing being that he was looking to the Almighty for the leadership. And then once he had that, then he was confident to go forward and lead others. That's why this all happened. And we should thank the Almighty for it, and the Almighty for using Dr. V and everybody else. It wasn't just one, it was many other people involved in doing this. And we use his name really as an example for that. Thank you very much for this honour of giving this talk. Thank you.